You are lying in bed, and you wake up because your hand is completely numb, dead. You cannot feel your fingers. You shake it, flex it, wait for the pins and needles to pass, and after a minute or two, it comes back to life. You roll over and go back to sleep. Or maybe it happens during the day. You are holding a cup of coffee, and your fingertips start tingling. You are driving, and your hands feel strange on the steering wheel. You are buttoning a shirt, and your fingers will not cooperate because you cannot quite feel them. And you tell yourself the same thing almost everyone tells themselves. I must have slept on it wrong. It is probably carpal tunnel. It is just a pinched nerve. It will go away. Sometimes that is exactly right. But after 60, hand numbness and tingling can be the earliest visible symptom of conditions that are silently progressing inside your body, conditions that are far more serious than a pinched nerve. And the earlier you identify which one is causing yours, the more options you have to stop it before it becomes permanent. My name is Dr. Michael Williams. Here are the 6 real causes of hand numbness after 60 and how to tell which one you are dealing with. Cause number 1. Vitamin B12 deficiency, destroying your nerve sheaths. This is the cause I see most often in seniors, and the one that does the most preventable damage when it is missed. Vitamin B12 is essential for maintaining the myelin sheath, the protective insulating layer that wraps around every nerve in your body. Think of myelin like the rubber coating on an electrical wire. Without it, the signals traveling through the nerve short-circuit, misfire, or fail to arrive at all. After 60, your stomach produces significantly less of the acid and a protein called intrinsic factor needed to extract B12 from food. You can eat a perfectly balanced diet and still become deficient because your gut simply cannot absorb it efficiently anymore. Common medications make this worse. Metformin for diabetes and proton pump inhibitors for acid reflux both further reduce B12 absorption. The tingling typically starts in the fingertips and toes simultaneously, both hands, both feet, in a symmetrical pattern. It may progress to numbness, then to a burning sensation, and eventually to loss of fine motor control, dropping things, difficulty with buttons and zippers, unsteady handwriting. Here is the critical part. If B12 deficiency is caught early, supplementation can halt the nerve damage and in many cases reverse it. But if it goes untreated for too long, the nerve damage becomes permanent. A simple blood test for B12 and methylmalonic acid can diagnose this in a single visit. If you have symmetrical tingling in both hands and feet, get this test before anything else. Cause number 2. Diabetes or prediabetes that you may not know you have. Diabetic peripheral neuropathy is the most common complication of type 2 diabetes, and here is what most people do not realize. It can start before you are ever diagnosed with diabetes. In the pre-diabetic phase, when blood sugar is elevated but not yet high enough for a diabetes diagnosis, nerve damage is already beginning. Chronically elevated blood sugar damages the tiny blood vessels that supply oxygen and nutrients to your peripheral nerves. The nerves furthest from your heart, in your hands and feet, are affected first because their blood supply is the longest and most vulnerable. The pattern is similar to B12 deficiency, symmetrical tingling and numbness in both hands and both feet. But diabetic neuropathy often includes a burning or stabbing quality, and it tends to be worse at night. If you have not had your fasting blood glucose and HbA1c checked recently, and you are experiencing tingling in your hands and feet, this test is essential. Catching elevated blood sugar early and bringing it under control can slow or stop the nerve damage. Cause number 3. Cervical spinal stenosis compressing your spinal cord. Your spinal cord runs through a bony canal inside your vertebrae. Over decades, the discs between the vertebrae and your neck lose height, bone spurs form, and the ligaments thicken. All of this gradually narrows the canal. When it narrows enough to compress the spinal cord itself, the result is a condition called cervical myelopathy, and its earliest symptoms are often numbness and tingling in the hands. Here is how to distinguish this from B12 or diabetes. Cervical stenosis typically affects the hands more than the feet in the early stages. You may notice clumsiness with fine motor tasks, difficulty with handwriting, trouble picking up small objects, or a feeling that your hands are weak, even though they look normal. You may also notice that your balance has subtly worsened, or that your legs feel slightly stiff or heavy when walking. This is important because cervical myelopathy is progressive. The spinal cord does not tolerate compression well, and if the narrowing continues without treatment, the damage can become irreversible. If your hand numbness is accompanied by increasing clumsiness, grip weakness, or any change in your walking or balance, see your doctor and ask specifically about cervical spine imaging. An MRI of the cervical spine can show exactly how much narrowing is present and whether the spinal cord is being affected. Cause number 4, carpal tunnel syndrome, but not the version you think. Yes, carpal tunnel is a real and common cause of hand numbness. But in seniors, it often presents differently than in younger people and gets missed because of that difference. In a 35-year-old, carpal tunnel typically causes numbness in the thumb, index, and middle fingers with pain that wakes them at night. In a senior over 60, carpal tunnel can present as a vague, diffuse numbness across the entire hand, loss of grip strength, difficulty opening jars, and a tendency to drop objects. The classic three-finger pattern may be less distinct because the nerve has been compressed for so long that the symptoms have spread. The reason this matters is that carpal tunnel is one of the most treatable causes of hand numbness. A nerve conduction study can confirm the diagnosis precisely, and treatment ranges from wrist splinting at night, which works remarkably well for mild to moderate cases, to a minor surgical procedure that releases the compressed nerve and provides permanent relief. Do not assume you are too old for carpal tunnel, or that carpal tunnel is only a young person's problem. It becomes more common with age, not less. Cause number 5, circulation problems from peripheral artery disease. When the arteries supplying blood to your hands and fingers narrow due to plaque buildup, the reduced blood flow can cause numbness, tingling, and coldness in the fingers. This is more common in seniors who smoke or have a history of smoking, who have high cholesterol, diabetes, or high blood pressure. The distinguishing feature of circulation-related numbness is that it is often triggered or worsened by cold temperatures. Your fingers turn white or blue when exposed to cold, then become painful and red as they rewarm. The numbness may come and go depending on activity level and temperature. If this pattern matches your experience, your doctor can check the circulation in your arms and hands with a simple, non-invasive vascular study. Cause number 6, medication side effects. Several commonly prescribed medications can cause peripheral neuropathy as a direct side effect. Chemotherapy drugs are the most well-known, but the list includes some that may surprise you. Certain antibiotics, particularly fluoroquinolones like ciprofloxacin and levofloxacin. Statin medications for cholesterol, which can cause neuropathy in a small percentage of users. Some seizure medications, and long-term use of high-dose vitamin B6, which paradoxically can cause the same kind of nerve damage that B6 deficiency causes. If your hand numbness began within weeks or months of starting a new medication or changing a dose, mention that timeline to your doctor. The connection may not be obvious to you, but it will be immediately relevant to them. Here is what to do right now if your hands are going numb or tingling regularly. Step 1. Get blood work. Ask for B12, methylmalonic acid, fasting glucose, HbA1c, and a complete metabolic panel. These 5 tests cover the 2 most common systemic causes and can be done in a single blood draw. Step 2. Pay attention to the pattern. Is it both hands equally or one hand? Is it the fingertips or the whole hand? Does it happen at night, during the day, or both? Is it worse with certain positions or activities? Write this down before your appointment because the pattern tells your doctor which direction to investigate. Step 3. Mention every medication and supplement you take, including over-the-counter ones. Bring the bottles if that is easier. Step 4. If blood work is normal and the pattern suggests a structural cause, ask about nerve conduction studies and cervical spine imaging. These are the tests that identify carpal tunnel and spinal stenosis specifically. Do not accept tingling hands as just getting older. It is your nervous system sending a signal that something needs attention. That signal is a gift because it gives you the chance to act while the damage is still early and often reversible. Ignore it long enough and the window closes. If this video helped you understand something you have been dismissing, subscribe. Share it with anyone who has been shaking their hands awake at night and telling themselves it is nothing. I am Dr. Michael Williams. Listen to what your hands are telling you, and I will see you in the next one.